It's a pilot.
It's kind of pilot.
It's a pilot.
We're about to show you a real-world implementation of interactive alerts being used in Karachi, Pakistan to track patients in a pneumonia surveillance study for a 2-year period. We'll be using RFID tags in the form of a bracelet like this and a Nokia 6131 NFC phone that has an RFID reader and writer embedded in it. At the Data Management Unit, IDs are assigned from the server to RFID tags that will later be issued to patients in the form of bracelets. In Pakistan, culturally, the bracelet is very acceptable. We can assign IDs of different types. For this demo, we'll use test patients. Tags can also be reissued to patients in the case of damage or theft, while our system can disable the older tag and keep track of the current active tag for that patient. We are now at an EPI center where our field worker enrolls patients. After the parent has consented to participate in the study, the field worker scans a bracelet to activate the tag and ties it on the child's wrist. This change in tag status is posted to our server and can be viewed in real time. The field worker now collects further information about the child to complete enrollment. All patient data will now be linked to the patient ID on the tag. Now suppose the child is ill and visits a surveillance GP clinic. We have placed the same Nokia phone in a housing on the GP's desk. The child comes in, the GP examines the child, scans the tag, and enters the diagnosis. This diagnosis is sent to our server in real time using GPRS, which generates an alert SMS आ गया to the mobile team, which consists of the surveillance medical officer and a phlebotomist waiting to respond to events occurring with our study subjects. The mobile team has now received the SMS. They know the time the child came in, where the child is located, and what was diagnosed by the GP, so they can respond to the event immediately. The mobile team has now responded. The surveillance medical officer examines the child and documents the event. In some cases, the phlebotomist may need a blood sample. After drawing blood, the phlebotomist scans the tag and enters the culture tube ID on the Nokia phone. The blood sample is now also linked with the patient ID on the RFID tag. The same is done for all lab results and x-rays. All field data is available online. For example, we can get a quick summary of all patient encounters by entering the patient ID. Under the GP tag, we can see the diagnosis, the GP's location, and so forth. With interactive alerts, we can monitor events in the field as they happen, and it gives teams the ability to respond immediately to emergencies. This system links all patient data from enrollment to lab results in real time.
So this was just to give an example of how to use technology. I also want to show the simple use of mobile phone, which can be used in Pakistan. Because as a technologist, I can certainly appreciate these breakthroughs and advances in the technology, but there are some very simple things that can be done using existing and pervasive technologies that makes big difference. So I think simple use of mobile technologies can be life-saving at times. And the video which I'm talking about is, I saw this Indian movie a few days back. So this was a funny movie, but it left a great impression on my mind. And I would like to show just a part of it, that how existing ICTs, including mobile phones, computer, and other technologies can be beneficial. In this clip, the woman is about to deliver a baby, but stuck in a disaster situation. And you will see how her friends basically contacted a doctor who helped her out by using technology. So this is just to give you a real world scenario.
डिसाइड नहीं कर सकता।
You're right, Dad. Close your sight. Murder था।
There's a back
कई इलाकों में सड़कें पूरी तरह से पानी में डूबी हुई हैं। यातायात पूरी तरह से ठप हो चुका है।
सर पे चिपक जाता है, फिर बेबी को बाहर खींच लेते हैं।
मैं ये बना सकता हूँ। I can make it. कैसे? वैक्यूम क्लीनर सर। वैक्यूम क्लीनर? Yes sir, वैक्यूम क्लीनर।
वैक्यूम क्लीनर का प्रेशर ज्यादा होता है राजू।
प्रेशर में कदर कर लूँगा।
वहाँ है वैक्यूम क्लीनर?
है मेरे ऑफिस में।
So this goes on. Basically, the idea was how to introduce technology in the real world scenario, right? Like computer was there, mobile phone was there, so at least otherwise it was not possible for them to know how to deliver a baby because they have no idea what to do now. So in such kind of situations, such kind of scenarios, these technologies can be helpful. Well, before I take questions, if we have time, I would like to thank all of you as my fellowship is going to get over next month. I had a memorable time of my life here. I'm extremely grateful to each one of you with whom I've rubbed shoulders with in some capacity or the other. First and foremost, I would like to thank my immediate supervisor, Andrew Broderick, without whose help nothing would have been possible. My special thanks to David, Mary, she's not here, everyone. They are supportive since day one. An equal measure of gratitude to my whole team, who helped me during the last whole year. Last but not the least, I owe special thanks to all the administrative staff and all the people in this building who helped me during the last 1 year. And also I want to thank my housemate who's not here, but she was a good mentor to me actually. She is in healthcare field. Thank you so much everyone. Now I can take questions.
As we do that, I know some people have to leave either for appointments or whatever, but I'd like to start, and thank you for a wonderful overview. That's really, even in all the time I've been here, there's been a lot of gaps in my knowledge about the healthcare system in Pakistan. Could you share what I'm intrigued with is just how broad, and I think other people here are as well, how many individuals are using mobile